All right, so we're back, and you had a nice little introduction, if you will, into some causes of AFib. But now we got to go a little deeper. This is where I need you to put your pathophysiology hat on and roll with your girl. Here we go. History of strep A. Strep A, what is that about? Well, strep throat. So here's how you got to look at this. Penicillin did not come out until about the 1930s or so, and widespread use of penicillin or penicillin products to treat strep throat weren't really in full swing till about the 40s or 50s. And so when you look at the age of your patient right now, I got a news flash for you. They were a child who probably had a lot of strep throat, or at least one bout of strep throat, when they were little, before penicillin was widely used. So your 80-year-old patient right now was a child, most likely with episodes of strep throat. Now, this is why we say aging can affect how many people have AFib. So think about it like this. If you have strep A or strep throat, and it's not being treated because there is no treatment at the time, then it can progress, as you already know, to one of two things, one of which has nothing to do with AFib. That's called glomerular nephritis, you know, like tea-colored urine, or it could progress to rheumatic heart disease or rheumatic fever. In particular, if this is going to advance to the complication of rheumatic fever, the patient's mitral valve is going to be affected. And I don't know if you know your anatomy, but when I talk about AFib, I have a question for you. Which side of the heart am I talking about? Am I talking about the left or the right? Because it turns out many students have said they were taught the right side, which is wrong. It's the left side. So look at this. Strep throat or strep A turns into, if not treated, rheumatic fever, rheumatic heart disease, which damages the valve that is right after the left atria. In this case, we say try it before you buy it. So the bicuspid or the mitral valve. This is the progression into AFib, because I taught you that valves prevent backflow. They're in all of our veins in our body, and they're also in our heart, and they prevent the backflow of blood. So imagine that if your mitral valve is not doing really well, and there's disease process there from rheumatic fever, subsequent strep throat, 3 or 4 weeks earlier, then that valve will not prevent backflow, and that backflow will occur in the atria, the left atria, and left untreated, that can turn into a stroke. So I hope that helps you kind of sort out a few kind of tricky things, because I would wager that most of our great-grandmas and grandpas and grandmothers and grandfathers had strep untreated, and we know now that that can cause AFib.